solemnly swear
do solemnly swear
that I will fully execute the duties
that I will fully execute the duties
of the office of
of the office of
member of the Tarrant County Hospital District
member of the Tarrant County Hospital District
Board of Managers
Board of Managers
of the state of Texas,
of the state of Texas,
and I will to the best of my ability
and I will to the best of my ability
preserve,
preserve,
protect,
protect,
and defend
and defend
the Constitution and laws
the Constitution and laws
of the United States
of the United States
and of the state of Texas.
and of the state of Texas.
So help me God.
So help me God.
Can't turn back now, you're a board member. Welcome.
He says he's busy, he will be. Enjoy meeting your son too. Y'all have a great day. Thank you so much.
So you can have it forever. So on your down days, you can just listen to people clapping at you. Thank you very much.
All right, then, we will officially call this meeting to order at 1:10. And again, Dr. Simmons, Steve, we certainly welcome you to join the board. I'll just take a moment. I may have said this a meeting back. I had the pleasure of being in Commissioner's Court, Robert, about a month ago, when Dr. Simmons was unanimously approved by the Commissioner's Court to join this board. He is certainly not a stranger to JPS. I believe he did his family practice residency and internship, and is a former member of the physicians group at JPS. And more recently, you may have seen his name. He was actually on the Citizens Blue Ribbon Committee, along with two of our board members, of which Trent's here today, and served with him on that committee. So all I can say again, welcome to the board. So
Mr. Chairman, may I interrupt for a minute?
you have, go right ahead.
Now that there are two Steves on the board, can we differentiate us somehow? Like I could be
Good Steve, bad Steve.
good Steve, bad Steve, and I'll let you decide who's who.
We'll know where that goes.
That'll be easy.
Point well made. And Mr. Adams, I'll let you introduce it. I know you have a guest also. here today.
I'm pleased to introduce, every summer our law firm hires summer interns from the Texas A&M University School of Law. Raymond Lee is with me today. Raymond is a undergraduate degree from the University of Texas at Austin. Mr. Montgomery was talking and didn't hear that, but that's probably good. But will be a third-year law student at Texas A&M University School of Law, and Raymond, we're pleased to have him with us. His family, his mom and dad, immigrated from South Korea and are citizens, and he's pleased to be here, and I'm pleased to have him with me this summer.
Welcome. So again, everyone's been welcomed, and we're glad everybody's here today, and thank you for everyone else. Any citizens who are in the audience, thank you all very much for being here today. We will now open with our prayer, and I'd ask Ms. Leanne Franklin, who's Director of our Spiritual Care and Ethics, to please come forward, and once she's finished, if you'd please join me in the Pledge of Allegiance. Thank you very much. Leanne?
So much. This is a great day. We have so much to celebrate. As we know, every day, every moment is a new beginning. But at times like this, when we have a new board member, we have new leadership in the hospital, we have new interns, we have Reverend Emerson back, it's certainly a day for celebration. Can you feel the energy in the room? On that note, let us pray. We gathered together today, so grateful for this moment in time. Grateful for all who are assembled here. Grateful for the possibility of this new community that's forming as we have the privilege of serving the community that we have been called to serve. We ask that we be open to all the ideas in the room, that we be welcoming of one another, that would be especially turned and attentive to all the needs of the community, especially the needs of the least of these. Let us be open to wisdom that comes to us from beyond this room, and let us continue to be grateful for this opportunity to serve. All this we pray in your holy name. Amen.
Thank pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
He just has his name, so I would do it individually.
All right, thank you all very much. Leanne, thank you again very much. The next item, item number 3, is citizens wishing to address the board. I've been advised we have one, and I think he's here individually, and Mr. Steve Townsend, if Steve would like to come up. Steve, the podium's all yours, my friend. Welcome, Steve.
Thank you, Mr. Chairman, Mr. Adams, Mr. Early, members of the board. On behalf of Tarrant County's longest-serving commissioner, J.D. Johnson, he would like to thank you for welcoming his new appointee to the board. Point of personal privilege, he is probably the best friend I ever had. He is all you said, Mr. Chairman, and more. Served our country as a Green Beret. The fact that he is an Aggie, I will not hold that against him. And I love him dearly, and I know you will too. Thank you very much.
Steve, thank you very much for your comments. And Steve, thank you for all you do in support of this district and working for the commissioner. Thank you for your time also. So again, Steve, welcome again. The next item of business is the approval of the minutes. They've been provided previously. They're on the portal. If there's no changes or any discussion, I'd entertain a motion for approval. Have a motion?
Second.
I have a motion, second by Mr. Fisher. All those in favor say aye. All of them, thank you very much. Robert, I guess they've got us this month. I guess any comments is ahead of yours, and I just have two, and I'll make them fairly quick. You know, as this board, we go to a lot of meetings, we come and go. We're excited about our new members. We have tenure on this board, some 9, 10 years. We've all been through a lot of things together. Ralph, I personally want to thank you. I know you've had some difficulties. I had the pleasure, being talking to you recently, but I was also there with your lovely wife when you went through your issues and with your family. Let me tell you something, we are so glad to have you back, and I really mean that. Second thing is, we also have Dr. Weber, who's not here today, just advised this board. Went to see Chuck when he was in for his surgery. He's home, he's doing fine. He's recuperating. I know, Robert, you probably talked to him recently too. I've checked on Chuck a few times also. And again, as I say sometimes, it's easy to say we probably all agree on everything. We don't, but we're kind of like a family. And so we do go through those issues. And again, Ralph, glad to have you back. Chuck's doing well and hopefully should be back by the next meeting. So that's kind of the first part of my comments. And the second, Robert, I've said this many times, this board as chair, I do a lot of things that previous chairs have done. I do things to community. I represent the board, and I'm very proud to do that on behalf of this board. And I also get to go to a lot of JPS functions that board members are certainly invited to. This past Friday, many of us in this room, and Steve, I appreciate you being there at the breakfast. Robert, you were there to speak. But I really think the real credit goes to Dr. Elliott. I know Tricia's here, but there was research day, and it was from literally from 8 o'clock. I think we got there before 8. It was from 8 o'clock in the morning to 3 o'clock in the afternoon. I'll probably get the number of people wrong, but I believe there's over 16 presentations, huge crowd, 40-something presenters, all about research. I know the staff was in and out during the day, and I'm not about to say it here. I've told you all along, I'll try to be as transparent as I can. Montgomery and I made the breakfast in the first couple of meetings. We did not make 3 o'clock, but I know other board members may have stopped by during the day. Tricia, would you stand up and be recognized as an outstanding program? And you may want to thank some of your people.
Thank you, Mr. Chairman. I just want to thank our team, the Academic Affairs team, the Office of Clinical Research, Center for Outcomes Research, also our wonderful communications department who's right there alongside with us doing this together. So it was truly a collaborative effort, and thank you for all the continued support from the board and all the members here at JPS. Thank you.
Dr. Elliott, thank you very much. You know, we continue to hear the word collaboration and working with other health cares. If you see the people that presented this and the interaction between all the different groups, we're doing that. So again, Dr. Elliott, thanks to you and your team. And Robert, at this particular point in time, I'll turn this over to you for your report.
You bet. Thank you, Mr. Chairman. And to that point, on Research Day, we had some 3 winners in the oral presentation category and 3 winners in the poster presentation category. First place went to Sitara Paladuga, and second place went to Andrew Clothier, and third place went to Alex Andalus. And then in the poster presentations, Julian Nguyen received first place, second place went to Sasha Dibb, and third place went to Brian Wananunu. And it was quite a presentation. And some of the posters you'll see out in the hallway when y'all take a break or when you're leaving, you can take a look at those and the amount of work that went into them and the research that's going on here. I wanted to also point out to y'all, you know, JPS is a tough place because we deal with tough issues. And sometimes we have to take a break and enjoy life and smile and realize that. So it is approaching our talent show. And our talent show is our mini version of America's Got Talent. And I think we do an exceptionally good job. But I have been remiss, and I must apologize, because in the past, I have not allowed or let you guys know on the board that you are willing and welcome to be participants in this. I know that Roger Fisher does a fiery baton act that's been good, that helped him get elected into the city council, and I know that DT Wynn does great impersonations of a variety of folks, and so y'all have some incredible talents. And so you all are more than willing to go through our process, and if you're so chosen, you too can be selected to be one of those people on that stupendous night to come out and present and show your wares. Or you could be Dorothy DeBose and be one of our more celebrated judges. So we can tap you for that, either which way.
Robert, I thought it was one of the few, I guess, opportunities the chair has. I thought I got to appoint people to participate in that kind of like committees. Does it not work that way?
Well, I will say, you know, Charlie's being humble. Charlie has decided he is going to participate this year. And
I should have never brought that up. Let's move right along, Robert. Yeah, let's move right along.
Look at all those happy faces to know that our chair is going to be part of Talent Night.
I will be at Talent Night, but not as a participant. Anyway.
One of the things that we just concluded, which has been spectacular for JPS, is, you know, we get together 2 and 3 times a year to create the Leadership Development Institute for our employees. We take people that are directors and managers and up, and we sit down with them and we talk to them about goals, and we talk to them about where our finances are. And it's an opportunity to spend a little bit of time outside the facility to really have a one-day event focusing on the direction of this organization. And those have been hugely beneficial for us. We've done those now for almost 10 years. But one of the things that we decided to do, and Laura Burnside and her team spearheaded a lot of this effort along with communications and others and JR, is to put together a group of our employees that may not be invited to some of those functions. And we went to the leadership and we said, find us people in this organization that show that they really represent the 3 rules of JPS. They own it, they seek joy, and they're not jerks. And we brought those people together, and we have about 400 of those people now. And we get together at this time, we got together at the Hearst Convention Center, and we put on some seminars, and we put on some programs for them, and it was fantastic. What was interesting is the seminar that we had, and we had 3 incredibly great breakout sessions. And I don't want to take anything away from the other 2 that were done by our incredible team, including Dr. Hochberg and Diana Prachel and Dr. Duncan, and then J.R. Labby and Pia Walker did one. But the one that got a good many comments and probably got some great recognition were the ones that was presented by our physicians. And we had Dr. Nia Karras and Dr. Schrader, Dr. Kramer, and Dr. Hurd. And that showed our physicians what the hardworking employees of JPS do, and that showed the hardworking employees of JPS what our physicians do. And that was incredibly well received. So I can't thank the physicians enough, and certainly we'll invite you as board members to some of those events going on in the future. That was our biggest event for those folks, and it really was a huge success. Wanted to let you know that. Also, a shout out to Dr. Neokaris. As you know, as we mentioned last board meeting, Dr. Neokaris serves as our Chief Medical Information Officer. And Dr. Neokaris, along with 2 other employees, went to Salt Lake City to the class KLAS, the gentleman who started it, research facility, and dealt with talking to them about how, as we reported to y'all last board meeting, we have the highest ranking for physician engagement regarding our electronic medical record and the support services of IT. And they went up and presented and were up there, and they got to talking about our culture at JPS and what we do for our physicians and what we do for our employees. And that group was so impressed by their presentation that we did a webinar yesterday. It's a nice webinar that many can tune into and listen to. And so Dr. Neokaris and the team did a great job at representing JPS. So it's one more opportunity. Sometimes we talk about, well, where's the word getting out to and who's hearing about us? That's a prime example of how other institutions in the nation heard about JPS and said, tell us more about how you change culture at JPS and how you get folks aligned. So it was very, very impressive. Thank you, Dr. Neokaris, for all your hard work in that regard. We have 1 new fellow coming in, and we have 2 new summer interns, and I'd like to introduce them. If Julian Orozco would please stand up. Julian and Allison Clark is our intern. Julian is our fellow, Allison is our intern, and Eric Hampshire is another one of our interns, and we are delighted they are here with us. If you will look at these 3 incredibly talented people, if you will make special note of Allison, she's the one that runs the ship. Her tour of duty prior to coming to JPS was in the United States Marine Corps. You do not do anything unless Allison either approves of it or tells you to get down and do 20. So I am impressed with that team. They're a good group of people, and that's what we do from an incubator standpoint. Many of our interns and fellows have become an integral part of JPS, and that's starting from the very beginning and getting them involved in JPS. And depending on what their wishes and desires are and how things work, you may see more of them here at JPS. Thank you all for being a part of JPS. Appreciate it very much. And I believe that's my report, Mr. President.
Sure. Robert, thank you so very much. That would move us along to item number 7 on the agenda, which is a report from the medical executive staff. And Dr. Schrader?
Well, thank you, Mr.
Floor
Chair.
is all yours.
Sometimes following Mr. Early, he gets to take all the good news. So I think he forgot one bit of good news that we could share. So shortly after I was elected president of medical staff, him and I sat down and discussed an opportunity to pull all the medical staff leadership away off campus and have a physician leadership retreat with him and other key administrators. So on May 30th, 15 of our chairmen and committee chairmen retreated with Robert off campus and really allowed for some team building. Got to decorate some cakes, and there's some other really kind of quirky stuff we did that was fun. And then continue meaningful dialogue with Robert in terms of vision and strategy and directions we're going. So wanted to make sure the board was aware that had occurred. I think it was a really exciting time in our medical staff leadership. I think for a long time, we've not been as engaged as we should have been, and I think this was the start of that. And so credit where credit is due is to Suzanne Barnes for setting up the day. We could not have done it without her, and I think it was truly enjoyable, and we'll continue to do it from here on out. So outside of that, that's my report, Mr.
Great.
Chair.
Dr. Schrader, thank you for your leadership. Item number 8 is a report from a claim. And Dr. Huchberg, I think you're coming up. I think you were introduced, or is Diana, you're coming up? Thought you're both coming up. All right, great. Diana, y'all come on in. As many of you know, Chuck chairs the Acclaim Exec Committee. He's not here today, so the floor is all yours.
Good afternoon. Certainly the best thing that's happened to Acclaim over the last month is the arrival of Dr. Michael Huckberg. Thank you, Dr. Huckberg. Got it. The arrival of Dr. Huckberg. So we're so glad to have him. He's been with us about a month. Steve asked me on the way in, did we give him an appropriate initiation or hazing? I want to assure you that we did. He's from Manhattan. He was homesick, so I took him over to New York Avenue. We worked on a Habitat for Humanity house on the hottest day of the year so far. which he has explained to me might be the worst day since he arrived. So,
It was really the best day of my life, hammering and banging my thumbs, because I'm so used to building homes in New York City.
it was a fun day, and the team had a great time getting to know him. I'm going to give you a very short report, and then we'll let Michael share a little bit about himself. Since our last visit here at the board, we've onboarded 7 new providers. Key onboarding for us this past month, Dr. Sandra Parker has joined us as the medical director at our Azle Clinic. And a new psychiatrist, Dr. James Halliburton, has joined Dr. Podewell's teams. As you know, psychiatry is one of those difficult to recruit positions, so we're happy to get those folks on board. We have another one coming soon. We still have ongoing recruiting for key positions in neurology, ENT, derm, vascular surgery. And as folks have asked us, I do want you to know that we have those with outside recruiters. Our more difficult recruitments, we do use outside companies to recruit. We've had a fair or decent number of candidates. We just haven't found the right fit for our system. And we do want, part of a claim is really getting the providers here who we want to stay here, who are going to grow and become a part of our culture for a long time. We have 2 internal recruiters, Rebecca and Crystal Hernandez. They've been with us for a while. They do a lot of our career fairs and our internal networking. We use a large number of association or specialty-based career pages as well. So when we're recruiting for psychiatrists, we go to that professional association. We post ads on their job sites or career pages. And we do have a LinkedIn site as well. So do want you to know that we've got our footprint in a lot of places. We're excited to say we've extended an offer to a vascular surgeon. As you know, with the transition of surgery, we have been covering with some locum coverage and some internal coverage. A wonderful young man from the Seattle, Washington area, and he is just this close to getting that contract signed and will be able to be here this fall. And we'll share that with you as we get that signed. But at this time, I want to turn it over to Michael and let him share a little bit about himself and tell you what he's going to be, how he's going to be keeping busy over the next many years, I hope.
So first and foremost, I just want to thank everybody for the opportunity to introduce myself here and just speak very briefly about myself. I have spent the last month, I think, introducing myself about 1 billion times, and I'm a little tired of actually talking about myself. Amazing as that might sound from a physician, I've grown a little bit tired of talking about myself. So I am emergency medicine by training. I am born and bred in the Bronx and spent my entire life in the New York City area. I trained at a hospital called Jacobi Medical Center, which is part of the New York City Health and Hospital System. And my mother worked at Jacobi for 30+ years in the back T labs there. And she grew up right around Jacobi. I grew up about 2-3 blocks away. And working at Jacobi, seeing my mom work at Jacobi, really, truly resonated with me because it revealed to me the importance of giving back to the community that you're raised in. And from Jacobi, I became an attending at Montefiore, and from there I became the medical director at the University of Massachusetts of their Level 1 Trauma Center. And from there I became chairman at 2 different hospitals. One was a hospital called St. Peter's, which is independent Catholic faith-based hospital located in New Brunswick, New Jersey, in a very highly competitive marketplace less than a mile away from Robert Wood Johnson. And in that department there, I took a department that had the first percentile in patient satisfaction. We got it up to the 99th, and door to doc from 90 minutes down to around 15. But academics was really where my passion lay, and I joined the Brooklyn Hospital Center, a safety net hospital in Brooklyn, New York, ironically, hence the name. And it was a 4-year emergency medicine residency program. And really, I joined that to debunk the myth that just because you're an inner city hospital, urban hospital, that you can't provide top-level, high-quality care in an environment with scarce resources, overcrowding, and chronic disease. And I really thought I'd be there 3, 4, 5 years and move on to an AMC. I was re-recruited, though, back to St. Peter's by the CEO, and I became Chief Operations Officer for the hospital, as well as the president of their medical group. I was there for about 2 years, and we took a hospital that had a negative operating margin and made it positive. And At that point in time, as New Jersey healthcare landscape was quickly changing and a lot of consolidations were occurring, and even though we were in discussions with some out-of-state partners to partner with them, there was a lot of discussion about potentially the organization being acquired. And I thought that was an opportunity to see what else lay out there, considering a lot of my family had moved out. And I looked at a number of institutions, and I came down to JPS and met with Robert and met with Mr. Powell and Dr. Weber and a number of providers and walked the halls. I came down here about 4 different times, and it truly brought me back to my days at Jacobi and seeing the patients, seeing the smiles on the faces of the employees despite very difficult circumstances and challenges that we all know we face. But understanding the importance of healthcare providers, that we need to be held to a higher standard, that we all partake in the altruistic bond of healthcare, truly brought me back to those early days. And I took that leap of faith, just the dog and I, and I've been now in Fort Worth for almost 4 weeks, almost 4 weeks here at the hospital, and I can truly say that I do not regret that decision one iota. I am extraordinarily proud, happy, excited to be part of the organization, to be a part of the team. And I've taken these last couple of weeks to truly understand the culture and the mission, to speak to as many people and shake as many hands as possible. Because ultimately, even though I may hold the title of president of Acclaim, it's not my strategic vision, it's the community's strategic vision. And I want to know exactly what our needs are and how we fulfill it. And I've said this in a number of different meetings, and I'll say it here now. I view Acclaim not necessarily as a medical group, as a what. It's really a why. It's a delivery mechanism. It's about how we look at our care. It's about how we strategize about our care, and we deliver that in a multidisciplinary approach to truly impact the lives of the patients that we serve. And that impact is not necessarily on the medical side or the behavioral side, it's also on the social side. And so as I embark over these next couple of months, I really truly want to develop a strategic vision for Acclaim, and obviously that means to partake in a strategic vision for JPS and our patients. And within that, to create a strategic vision for each individual service line, because there's lots of opportunities that we have to further healthcare for our community. If, for example, you take an area like Stop 6, with just my simple Google mapping, there's a paucity of urgent cares within that community. The nearest one is about 6 miles, and it's JPS. So there are tons of avenues that we can explore to be able to impact the lives of our patients. And so again, I thank you. I'm glad to be here, and I look forward to the future journey.
Ralph, Reverend Everson.
Doctor, I have one question and then one comment. Question I have is, you've been here a month now, you said about. What's the one thing that you've experienced that has really been amazing to you since you've been here?
I've been very fortunate to be invited to a number of events within the organization. So I attended ADI, and seeing that enthusiasm from our employees just completely overwhelmed me and proved to me that this was the right decision for me. Just seeing the commitment to our patients has been something that I've rarely experienced in my life.
I have the unofficial title of the mayor of South Six. You mentioned Stop 6 a moment ago. Actually, that's the district I represent. There's a group you have yet to visit, and that is that area that I would like to extend an invitation for you to visit that particular area. There's an area in that area kids. 125 kids, that we'd love for you to come speak to them.
It would be my honor and pleasure. I want to get out to the community as much as possible, and I'll be there.
I already have you on the calendar.
Fantastic, fantastic. I will cancel all appointments.
Does the board have any other comments? Ralph, I think that's well. I had the pleasure of meeting Michael the first day, obviously during the interviewing process, then he elected to take the position. He walked in his first day, and I think we had an 8 o'clock, I think the first meeting was an 8 o'clock claim meeting that Chuck was chairing your first day. And I know for 4 weeks, you've been very busy. I would challenge the board. You can tell his enthusiasm. You heard of his experience. You heard of all that. Reach out to him I know y'all are busy too. I know his schedule, but as he gets his feet on the ground, just like you said, Ralph, great point. You beat 10 others to him, but seriously, reach out. I think you'll be nothing but impressed and excited about him. And like he says, joining the team at JPS. Steve, I think did you have your hand up? Yeah. Any other comments or anything?
Do you have your cowboy boots, your cowboy hat, and your favorite barbecue spot?
I bought my dad a hat, but I have been forewarned not to use the phrase "howdy partner" in any forum whatsoever. So I'm still getting used to it.
Y'all. Practice the word y'all.
I got it. I'll get there.
All right.
I'll get there. The word "folks" comes out every once in a while. So
If we can put up with Aggies, we can deal with getting you to how to say that. So anyway. Michael, thank you very much. Diane, anything else on behalf of Acclaim? Thank y'all both very much. Item number 9 is our committee reports. I think we'll start off obviously with the Finance Committee of May the 24th. I believe I chaired that or the chairman of finance, so therefore it wasn't a very efficient meeting, a very professional meeting, and obviously in Mr. Montgomery's absence, basically everything is pretty much a part of our report. Sharon will give us any update information. Sharon, if you'd like to come up as far as the financial report and give you a summary of that meeting. I will also tell you during that meeting, as you know, there's a lot going on. The finances, Robert and the entire staff is engaged in everything from running numbers for anticipated possible bond programs to the budget. We talk about scheduling. So the financial piece and the financial part of the organization is very, very busy. So Sharon, I'll turn it over to you for an update on the financials.
Okay, thank you.
I have my head blocking that.
For the month of April, this would be 7 months through our fiscal year. You can see that the hospital performed well compared to budget. We actually had a positive margin of $33,000 compared to a budget of just over $100,000. Our admissions were right on target. Our patient days were about 6% over for that month. When you look at the Acclaim physician group, you can see that their budgeted loss was just over $1 million. They came in at $1.4 million. A lot of that is some timing and as well as their encounters being slightly down for the month, which is the trend for the year, by about 5% as we work on filling those open positions that Diana just spoke to you about. If you look at year-to-date, again, the medical center is about $1.9 million behind our operating budget. Some of these impacts were some changes in our supplemental funding structure and how we make intergovernmental transfers for other institutions, as well as a high employee benefit experience this year. And Acclaim is actually slightly beating their budget by about $50,000, as you can see on the board. Our foundation is doing well year-to-date. So if you look at, I can't really see that on my screen, but did all right. We're about $1.4 million behind in our operating budget for the 7 months. And if you look at our net income number, we are trending about $600,000 behind. Are there any questions on April? I did cover this in detail at the Finance Committee.
Fiscal year to date, we're 0.6 million, or .6 million, 600,000 off.
Yes, yeah, from the bottom line standpoint, yes.
Not too
Right
bad.
there.
That's pretty damn good. Yeah.
There's a lot of variances that go
I know.
into that, but we are trending very close to budget.
And we're a little over halfway. Actually, we're probably
7
3/4
months.
of the way.
Yeah.
Okay, great, thank you.
Yes.
So that says, we would project a balanced budget then.
When we project out, and there's some, again, the supplemental funding lines, and just as a reminder, when I talk about supplemental funding, we're talking about things like disproportionate share, UC, as well as DSRIP programs. That is always not defined until the end of the year. So we will get the state's final numbers sometime in late September, just before we close our books. So there are quite a few things that are up in the air, but trended out, not including any of those potential changes from supplemental funding. We expect to end the year at about $1.5 million compared to our $4 million budget.
Pastor, a good way to describe that is what we can control, we feel very positive about. To Trent's point, and Trent's brought this up when he was finance chair and when he was chair, is there's so much of JPS's budget that you absolutely have no capability to deal with. And we've said it before, if the federal government wants to change formula funding and tweak it in some way, move it up or down, we can gain or lose with an email. And that is a really hard portion to control. But I'm proud of the team and proud of the organization for where they are right now. It's a challenge in this type of an organization. But what we can control, we're doing well. What we can't control and what we won't know till the end of the year, end of the fiscal year, is going to be a potential challenge, and I just don't know.
It just appears that whenever we have a substitute sit in as the chair of the finance committee, things start looking up.
Ralph, don't go there.
Another good month. Another good month. Yeah.
Yeah, wait till the
Yeah.
damage. Yeah. Yeah. Are there any other important questions for this board at this particular point in time? Sharon, there's not. Thank you very much. Okay, we accepted the report. All right. The next item for committees is the Human Resources Committee, and that'd be Mrs. DeBose. Dorothy?
Yes, our committee did meet on May the 24th. We reviewed the annual incentives matrix, and we have some policies on the consent agenda. I think when we look at our matrix that we are monitoring, they were very good. So we'll continue to look at those. At our next HR meeting, we'll bring a little bit more in-depth detail for everyone. Okay. That's it.
Any questions for Dorothy? And I actually had the pleasure of having lunch last week with Steve, and indicated as a board member, we will get you on some committees here fairly quick, but you certainly have the right, and a lot of the board attends all the meetings, so you're certainly welcome at any one of the committee meetings. So anybody have questions for Dorothy? There being none, we'll go to item number 10, which is the consent agenda. I've been advised that we're going to pull item number K. It refers to a letter of intent. The board doesn't need to approve the letter of intent. That'll be coming back if that lease gets finalized for this board's consideration after it's been through legal counsel. And I asked, we're going to remove item number L, and we're going to open that up for discussion. Is there any other comments regarding anything else on the consent agenda? If not, I would ask for a motion for approval of the consent agenda. I have a motion by Dr. Emerson, I have a second by Mr. Bose. All those in favor say aye. Aye. No, thank you very much. And then let's go ahead at this particular time, and we will move to item number L. And I think Bill Whitman and Diana Pratchett are coming up to discuss that for any questions the board may have. Thank you all very much.
Thank you, sir.
Item number L.
Great. Thank you very much. We are bringing this contract before you today. It's a new 3-year contract for Sheridan Healthcare. They provide anesthesia services for the district. We have approved, this contract has already been approved by the acclaimed executive committee and comes before you today. The contract is a 3-year contract. They will remain at the same rate through the end of this fiscal year, and then beginning fiscal year 19, there is a little bit of an increase, $400,000 annually per year. That increase is related to services that we have requested that they add, expansion of services. Those include pre-admission testing phone calls. I think we piloted that in the last year. We're going to extend that service. That is a service that most hospitals offer before surgery. An anesthesiologist will call and check in with the patient night before surgery or night or two before surgery. There's going to be additional endoscopy room coverage. As most of you know, you've heard me talk for a long time about GI services at JPS. We have plenty of demand for that service and need to expand anesthesia in that area. We're going to expand service in our IR area, our interventional radiology area as well. And we're going to add another room at our Jessica, our outpatient clinic in Arlington. We'll have anesthesia coverage in another room there as well. And then we'll have some additional acute pain service consult on the floor for our inpatients post-surgery. So those are the expanded services. Sheridan has done a great job of keeping the costs as low as possible while expanding those services for us. Other questions
So
about
as you
that?
know, this is a coverage agreement,
Right.
and the coverage is for connection and self-pay. And most of our agreements, in fact, all at some point in time will transition to a claim, and thus the reason that Diana is representing the Sheridan agreement going forward.
We want to make, it was interesting, and we talked about this. When some of these come up and they go through a claim and trying to figure out the best way to deal with the board and the best way to deal with the claim, whether they should be consent items, whether they should just go through a claim or come to the board. So we're always happy to take these off of consent so you all can get any questions that you might have, and we can do the analysis that's needed to be done, whether it's a continuing contract or whether it's a new contract, either which way, and we'll be happy to take the board's counsel on which way is best to describe these or the best approach to deal with these. But removing it from the consent calendar is an idea just so we can make sure that all those questions are voiced.
Did you have a question?
Yeah, Mr. Chairman, and Robert, in the past, we've had issues come out of a claim that have been on consent. I, as general counsel, have viewed the claim as just like another committee of the board. You have two of your members that serve on that board as chair and vice chair of this board serve on that board. And if you want to, again, legally, from a legal standpoint, like Robert said, we can treat it any way you wish. If it needs to come from a claim and be a standing item to look at, or does it come to, on consent? I had viewed it, when asked by staff, that it ought to come as a consent item, and then if a board member had a question, they could pull it just like they could any other item coming from another committee of the board. But
Yes, Dorothy.
Since we have on the agenda for a claim as a regular presenter, they report to the board. I would see that when we bring a big contract like this, that they just should present it as a part of their report for
Good point.
approval.
Okay.
I mean, the rest of the things go through finance, we have a chance to really review it. So when something from them comes, it's a major part of our operation, and I just think it's just stand.
Good point.
That'd be fine, and that's a good process. We appreciate the direction of the board because we weren't quite sure exactly which way to go with all those.
Yeah, and Dorothy, I think this is just a part of the learning process. I know when Ralph and I served on the acclaim board, now Chuck serves on the acclaim board because it's a position deal. I think the intent was whatever happened there, at least comes through the board. I think your point's well made, and I think I don't think you want to look at every little small deal, but I think certain deals like this will down, and we'll look at that as we go forward, and we'll so advise Chuck of that also.
Thank you, that's.
and Scott and I work with that as it relates to the
So
agenda.
Diana, when we set up a claim a while back, one of our guiding principles was to have uniformity in our contracts and our reimbursements and our, all that kind of thing. And you may have said this while you were talking, Ms. Chairman was yakking in my ear. Does this comport with that, sort of that guiding principle? I mean, or is this, Sheridan, I know, probably has their own paper and they want to use it.
They do their own billing for the patients who we aren't covering. So patients with commercial insurance, Sheridan does their own revenue cycle, which is appropriate. But Acclaim has been working with Sheridan for a couple of years now on quality metrics and aligning them, cascading those down from the district, as we actually work with all of the physician groups here already. this contract was up for renewal, so it's time for it to be assigned to a claim completely, so, yeah.
But the template is
The template
very,
is pretty standard.
yes.
Templates are very standard, yes, sir.
So how many groups do we have that have not contracted yet with the claim?
So most of the large groups come up for renewal this year. So you have IES in the renewal process, OMFS comes up for renewal this year, Sound will come up soon, ProPath is coming up pretty
Radiology
immediately.
Associates.
But again, we do already work with most of these groups. We have regular contact. We have become sort of the point of contact for most concerns or challenges for our physician groups or our patients, and then we direct them to the right place. So the relationship, I think, is already solidified for everyone.
I think the timing for the clarification was great. Now we kind of have that because we do have some of those major contracts coming up.
You'll see them all.
We'll just bring them back through in that, so.
We'll make them part
probably
of
the
our
best way to handle
report. Yes.
Good.
Okay.
Any other questions for, yes, DT?
I just have a quick comment, because it's very, very hard when you have renewal or amendment, and there's a new rate or new fee, but there's no way we can tell what was the old fee would look like. So it's kind of very hard for us to follow through.
For this, so we tried on this contract, we've presented the $400,000 a year annual increase. If you would like us to present that differently on the executive summary, we're happy to do that,
Yeah.
any way you would like.
Like, for instance, I'm going to go back because it's on the consent agenda, but like for insurance contract and all that stuff, like the one this time around, it's specified, outpatient, and then a bunch of carve-out because provider-based billing.
Okay,
But we have no idea what was the rate before.
okay,
We kicked 150, so we have no way of comparing.
the before and after,
Right,
okay.
Just a cheat sheet, because I think it's also help the building department know what they are, how different they are, otherwise we sign and they may not. they
You
may
want to see
miss
the
that.
comparative data,
Just a quick,
old and what the
small,
change.
something.
Small table,
I
we'll do
I
something
think
for you.
you do that in your analysis anyway, we just need to
Can.
present that.
We have that.
You've got that
We do.
information, because
It's easy- it's
a
easy.
claim sees all that before they,
That's the
We'll
basis
just
of the contract.
bring, we just need to bring that forward as
Okay.
part of this discussion, DT. Yeah,
Not every
that's,
detail, but just major one.
Right. What major
changes.
changes?
Right.
Absolutely. Mhm.
no,
We'll bring it.
good questions. Anything else from Bill and Diana? If not, I'd entertain a motion for item number, I guess, 11L. Since it was removed, we need a motion for consideration.
So moved.
Have a motion by Mr. Fisher, second by Mr. Wynn. All those in favor say aye.
Aye.
Opposed, no. Thank you very much.
Okay, thank you.
Thank you. Brings us to item number 12, which is report of general counsel. Mr. Adams?
One, couple of items, on the contracts under 200,000, which have been posted to your web portal. For the month of April, there were 35. Contracts between 2 and 500,000, there were 2.
Anything else, Mr. Adams?
No, that's it.
Thank you very much for your report, which brings us to item number 13, which is our executive session. I'm advised we shouldn't have too many matters. We also have to deal with privileges, so we'll take about you want to take a 10-minute and come back and do closed. And I will tell the audience that there's not a lot of additional stuff on the agenda, but we should be through hopefully in about 20 minutes. So let's take a quick 10 minutes. Mr. Adams, you didn't hear what I said. We will now reconvene in open session, and I believe the last agenda item is privileges. And Dr. Schrader, if you...
So, Mr. Chair, attached you have your request for approval of medical staff credentialing activity for consideration by the board.
I have a motion for approval of Dr. Emerson, Reverend Emerson, and a second by Mrs. DeBose. All those in favor say aye. Opposed, no. Thank you very much. Is there any other business come before the board today?
That may be a record.
If not, I appreciate your attendance, and we stand adjourned. Steve, welcome aboard.